Hello everyone, I am Adeline from the Department of Physician Assistant. Today I am going to talk about the common disorders of cardiovascular system. Actually it is a vast topic, but then we will be seeing in brief about the common disorders, their symptoms, causes and the risk factors. So upon completion of the session, the students will be able to understand their symptoms, causes and the risk factors. Moving on to the most common disorders. Some of the most common disorders of cardiovascular system includes coronary artery disease, hypertension, congestive cardiac failure, arrhythmias, valvular heart disease, congenital heart disease, cardiomyopathy and peripheral artery disease or peripheral vascular disease. Now let us see about the coronary artery disease. Coronary artery disease is nothing but it is a common condition that affects the major blood vessel that supplies the heart muscle. The heart muscle is supplied by coronary arteries, which is mainly of two types, like right coronary and left coronary, and they are branching out into different branches. So cholesterol deposit, which is called as plaques, in these coronary arteries are the main cause of coronary artery disease. The buildup of these plaques is called atherosclerosis. This reduces the blood flow to the heart, and thereby the other parts of the body also gets reduced blood supply because the heart won't be able to pump enough blood to other parts of the body. It can lead to heart attack, chest pain, that is angina, or stroke. Now in this picture you can see the normal coronary artery and how the coronary artery is being deposited with the blood clot and the plaque on the side of the wall. Now moving on to the symptoms of coronary artery disease. The main symptoms include chest pain or discomfort, that is angina. Angina can range from mild discomfort to severe pain. It may feel like heaviness, tightness, pressure, aching, burning, numbness, fullness, squeezing or a dull ache. The discomfort may spread to shoulder, arm, neck, back or jaw. Shortness of breath or trouble in breathing, feeling dizzy or lightheaded, then having palpitations, feeling tired, nausea, stomach discomfort or vomiting. This may feel like indigestion and then weakness. So causes and risk factors of coronary artery disease. Now the causes, main causes, the atheroma, deposition of the plaque atheroma on the walls of the arteries. So this is the main cause of coronary artery disease. Risk factors of this coronary artery disease includes smoking, hypertension, that is high blood pressure, high cholesterol, high levels of lipoprotein, having diabetes, being obese or overweight, and having a family history of coronary artery disease. Next we will move on to hypertension and its symptoms. Hypertension, that is high blood pressure, is when the pressure in the blood vessels is too high, that is more than 140 systole and 90 diastole. It is common, but it can be serious if not treated. Most people with hypertension do not feel any symptoms. People with very high blood pressure, that is usually 180 systole and 120 diastole, can experience symptoms including severe headache, chest pain, dizziness, difficulty in breathing, nausea, vomiting, blurred vision or other vision changes, anxiety, confusion, buzzing in the ears, nosebleeds, abnormal heart rhythm. Things that increase the risk of having high blood pressure include older age, genetics, being overweight or obese, not being physically active, high salt diet and drinking too much alcohol. Now we will move on to congestive cardiac failure. Congestive cardiac failure or heart failure is a long-term condition in which heart can't pump blood well enough to meet body's need. Because it can't handle the amount of blood it should, blood builds up in other parts of the body. Most of the time it collects in lungs, legs and feet. The symptoms of congestive cardiac failure include shortness of breath, waking up due to short of breath at night, chest pain, palpitations, fatigue when you are active, then swelling in ankles, legs and abdomen, weight gain, frequent urination while resting at night, a dry hacking cough and a full bloated or hard stomach. Now, risk factors of congestive cardiac failure. Certain medical conditions can increase risk of heart failure, including coronary artery disease, then diabetes, high blood pressure, obesity, valvular heart disease. Unhealthy behaviors can also increase the risk for heart failure, especially people who have one of the conditions listed above. Unhealthy behaviors include smoking tobacco, eating food in high fat, cholesterol and sodium, not getting enough physical activity and excessive alcohol intake. Now moving on to arrhythmias. The arrhythmia means it is a irregular heartbeat, abnormal heart rhythm. So, heart rhythm problems occur when the electrical signals that coordinate the heartbeats don't work properly. The faulty signaling causes the heart to beat too fast, that is otherwise called as tachycardia, or too slow, which is called as bradycardia, or irregularly. Now, symptoms of arrhythmias. Heart arrhythmias may not cause any signs and symptoms, but in general, signs and symptoms of arrhythmias may include a fluttering in the chest, a racing heartbeat, that is tachycardia, a slow heartbeat, that is bradycardia, chest pain and shortness of breath. Other symptoms may include anxiety, fatigue, lightheadedness or dizziness, sweating, fainting, that is syncope or near fainting. The causes of arrhythmias include current heart attack or scarring from a previous heart attack, blocked arteries, that is coronary arteries, changes to the heart structure like myopathy, cardiomyopathy, diabetes, high blood pressure, infection with COVID-19, overactive thyroid gland, that is hyperthyroidism, sleep apnea, underactive thyroid gland, that is hypothyroidism, certain medications including cold and allergy drugs, drinking too much alcohol or caffeine, drug abuse, genetics, smoking and stress or anxiety. Risk factors of arrhythmias, they include coronary artery disease, other heart problems and previous heart surgery, high blood pressure, congenital heart disease, thyroid disease, obstructive sleep apnea, electrolyte imbalance, certain drugs and supplements, excessive alcohol and caffeine, nicotine or illegal drug use. Now, we will see about the valvular heart disease. In heart valve disease, one or more of the valves in the heart doesn't work properly. Heart has 4 valves that keep blood flowing in the correct direction. In some cases, one or more of the valves don't open or close properly. This can cause the blood flow through your heart to your body to be disrupted. Heart valve disease treatment depends on the heart valve affected, the type, the severity of the disease. Sometimes heart valve disease requires surgery to repair or replace the heart valve. Now, symptoms of heart valve disease. Some people with heart valve disease might not have symptoms for many years. When signs and symptoms occur, they might include whooshing sound, that is heart murmur, chest pain, abdominal swelling, fatigue. Shortness of breath, particularly when active or lying down, swelling of the ankles and feet, dizziness, fainting and irregular heartbeat. Causes of valvular heart disease. The most common heart valve disease include rheumatic fever from strep throat that wasn't treated, heart attack that damages your heart, high blood pressure, a congenital problem that has been present since birth, such as pulmonary or aortic valve that didn't develop right. Then degeneration or calcification of the heart valve tissue with loss of function over time. Thoracic aortic aneurysm, that is dilatation of aorta which stresses the aortic valve leaflets and can cause leakage. heart failure and infection in the heart, that is infective endocarditis. Now, types of valve disease. This types of valve disease includes insufficiency, that is otherwise called as incompetent valve or regurgitation, that happens when the leaflets don't close completely, letting blood leak backward across the valve. This backward flow is referred to as regurgitant flow. Heart has to pump harder to make up for this backward flow, and the rest of the body may get less blood flow. Types of valve disease, again other than insufficiency, it is stenosis and atresia. The valve flaps become thick or stiff and possibly fused together. This results in narrowed valve opening and reduced blood flow through the valve. Atresia means that valve hasn't formed or a solid sheet of tissue blocks the blood flow between the heart chambers. The risk factors of valvular heart disease. Several risk factors can increase the risk of heart valve disease, including old age, history of certain infections that can affect the heart, history of certain forms of heart disease or heart attack, high blood pressure, high cholesterol, diabetes and other heart disease risk factors and heart conditions present at birth. Now, we will see about congenital heart disease. Congenital heart disease is a defect in the heart structure that is present at birth. It can be detected before birth, soon after birth or any time throughout life. There are many kinds of congenital heart disease. Symptoms and treatment depends on the type of defect and its severity. There are two main groups of congenital heart disease, that is cyanotic congenital heart disease and acyanotic congenital heart disease. Now, what is cyanotic congenital heart disease? Cyanotic congenital heart disease involves heart defects that reduce the amount of oxygen delivered to the rest of the body. Babies born with cyanotic congenital heart disease usually have low levels of oxygen and require surgery immediate, that is called palliation or corrective surgery. Acyanotic congenital heart disease. Acyanotic congenital heart malformations are that affects the atrial or ventricular walls, heart valves or large blood vessels. Common causes are genetic defects, maternal infections, example rubella, maternal use of drugs or alcohol during pregnancy. Now, the signs and symptoms of congenital heart disease. Symptoms may start as soon as a baby is born or may not appear until later in life. They include cyanosis, that is bluish discoloration of the skin, lips or nails, excessive sleep, fast breathing or trouble breathing, fatigue, extreme tiredness, getting unusually tired or out of breath during exercise. Heart murmurs will be present, poor blood circulation, weak pulse or pounding heartbeat. The signs and symptoms vary widely depending on age, the number of heart defects. Sometimes the baby can be present with one or more heart defects. For example, tetralogy the baby will be having 4 different heart defects. The severity of the condition and type of defect. Now, causes of congenital heart disease. Congenital heart disease happens when the fetal heart doesn't develop correctly in the uterus. Scientists don't fully understand why that happens, but it may be related to abnormal chromosomes or genetics, drinking or smoking during pregnancy, and illness in mothers during pregnancy like diabetes, drug use, phenylketonuria or viral infection. Next, we will move on to cardiomyopathy and its types. Cardiomyopathy is a disease of heart muscle that makes it harder for the heart to pump blood to the rest of the body. Cardiomyopathy can lead to heart failure. The main types of cardiomyopathy include dilated, hypertrophic and restrictive cardiomyopathy. Symptoms of cardiomyopathy. This includes fatigue, palpitations, chest pain, arrhythmia, shortness of breath, swelling in your legs or ankles and syncope. Causes of cardiomyopathy includes genes we get from our parents. Researchers have found that thousands of genetic mutations that cause myopathies. Other cardiomyopathy causes include coronary artery disease, autoimmune disease such as connective tissue diseases, infections that affect the heart muscle, heart inflammation, diabetes, thyroid disease, muscular dystrophy, high cholesterol disease, sarcoidosis, amyloidosis and hemochromatosis. Now, risk factors of cardiomyopathy. There are a number of things that can increase the risk of cardiomyopathy, including family history of cardiomyopathy, heart failure and sudden cardiac arrest, long-term high blood pressure, conditions that affect the heart including a past heart attack, coronary artery disease or an infection in the heart, obesity which makes the heart work harder, long-term alcohol misuse, illicit drug use such as cocaine, amphetamines and anabolic steroids. Treatment with certain chemotherapy drugs and radiations for cancer also is a risk factor. Many diseases also raise the risk of cardiomyopathy including diabetes, thyroid disease, storage of excess iron in the body, amyloidosis, sarcoidosis and connective tissue disorders. So, these are some of the most common cardiovascular disorders. Their symptoms, causes and risk factors you have seen today. Hope you had a good class. Thank you.